On March 14, 2018, Randall Broad, a 10-year patient of stage 3 non-small cell lung cancer, sat down for a patient-physician dialogue with Dr. Gary Lyman from the Fred Hutchinson Cancer Center in Seattle, Washington.
Let's switch now, and I want to go get to your favorite part of your world, and that's the patient-doctor interaction, out of the research and the clinical aspect of things. As a physician, I come to you for the first day, and you're going to tell me you have cancer. From your position, what should I be thinking? I know exactly what I did think, but I'm curious as to what, from your perspective, how should the physician be approaching that with a patient?
So obviously these are very difficult conversations. Our first job is to confirm. So the patient comes in, we review everything. We don't just accept reports from the outside. We look at the pathology. We look at the imaging, the actual scans or x-rays. And often we meet in a multidisciplinary meeting where we have the pathologist, the radiologist, the various clinicians, the surgeons, the medical oncologists, and so forth. And we discuss the appropriate treatment. And ideally, that's done even before the patient arrives, but if not, it's done shortly after that this first visit. In terms of the interaction with the physician, the physician's role initially, obviously, is to both confirm or say we will confirm exactly what's going on, both the disease, the stage of the disease, and so forth. But then to describe the typical process, the steps that will be taken, if there are more tests that are needed, if there's a need for outside review, all of this, and then to discuss the treatment options. However, I always tell my trainees, remember that patient, with very few exceptions, is going through the worst period of their life. And most patients have not faced anything remotely like the experience of being told you have cancer and that your life is on the line. All this requires a really open, honest, get back to your word, transparency.
It's good to know that this will become absolutely more transparent. As you say, I like to use that word a lot.